Hello, I am Fatu Diba and I join other Gambians as we protest against the high rate of maternal deaths due to child delivery in the Gambia. We call for equitable access to gestation and maternal care. We call for extra training for healthcare providers in reproductive health care. And we call for the Gambia government to prioritize the funding of our healthcare sector. We call for the investigation into the negligence and incompetence that surrounded the death of Fatoumata Diba of Bakau. And we call for the dismissal and prosecution of anyone found guilty of negligence causing the death of Fatoumata Diba. You will hear me say her full name each time I mention her on this video. Please join me in voicing your outrage and your concern and in raising awareness on the plight of our Gambian women dying to have babies, literally. If many more of us can add our voices, perhaps we can get this Gambia government and our future politicians to fix our broken healthcare sector. Fatoumata Diba had her babies. Then she went home. And then a couple of days later, she started feeling sick. So she came back to the hospital where I guess she had delivered her twin babies. And of course, they turned her away because they suspected that she had COVID-19 because, they felt like the symptoms that she was showing at that time were symptoms of COVID-19. Don't hospitals in the Gambia care about and monitor the well-being of the mother after the birth of the child? Isn't there like some kind of 6-week care and monitoring period? Now, another question. As a hospital, how do you turn away a patient like that? A patient ko hamne mungi just am dom mungi just wusin. Nga just daha komo. Okay, so you don't have the ventilators to help Fatoumata Diba, so you send her off. Where to? You send her off, but where to? Foko, where's she going? The poor lady was driven from hospital to hospital, turned away each time. You did not value her life. Those of you that turned her away, you let her die. Why wasn't she referred to the right place? Why wasn't she referred to the Serakunda Clinic? I believe this is where suspected COVID cases should be referred, right? Why wasn't she directed to them? Please correct me if I'm wrong, but I believe it's the Serakunda Hospital, right? So why did she have to travel to all these hospitals, including MRC, just to be turned away each time when someone should have just been professional and referred her to the right place? She had twins about 2 days before, for God's sake. 2 days before. Somebody should have helped her. But this should not have happened if each hospital had been equipped with emergency equipment, ventilators. Fatoumata Diba should have been isolated and treated because she was a patient, a new mother. And then after that, maybe move her to the right location for COVID patients if indeed she had COVID. Not left alone to die like that, not left to die like that. Now, we know that she did not actually have COVID-19. And so they just let her die. Even if she did have COVID-19, they shouldn't have let her die. But of course, we know she had some kind of health issues after she went home, right, with her twins. She could have had an infection. She could have had dangerously high blood pressure. You know, she could have had problems with her C-section. If she had that. I don't know if she had that. You know, the nurses should have checked her, but they didn't. They were very unprofessional. They sent her away. The World Health Organization states that healthcare solutions to prevent or manage complications are well known. So why did the nurses at the maternal hospital that sent her away, the maternal hospital where she delivered her baby, turn her away? She had just had her twins with them. But then all other hospitals turned her away too. Ha! Mungo bon. MRC, everybody. Wow. This new government that's in charge is still practicing the same old negligence towards the Gambian people that we have seen in the past, from the previous government and the one before that. And it's sad and it's unfortunate. It is unfair. It is very unfair. And it is insensitive to the people of the Gambia. All three of our governments have failed to address our needs as Gambians by failing to regulate and fund our healthcare system whilst, they're in control. So in Lopitani. So in Lopitani. Melni du pour ay nit. Bala len ma de. Waaye xanaa rapis sax seen lopitaan yi nga xam ne moom lañ leen defaral pour fu ñu leen di fajee ñoom seen medical equipment yi ñu ngi correct ñoo gën a sotti ñun suñ yos nga xam ne ay nit lañ biir Gambia boobu suñ lopitaan yi bon ba bugg a dee you probably get better treatment at a vet hospital than at a human hospital in the Gambia. It's really sad. Now, we have some amazing professional medical personnel in the Gambia who are educated in the Gambia, educated internationally, but the tools and the resources that they need to practice their profession and help Gambians easily is not a priority for our Gambia government. It never is. Nothing ever is. And that makes me really sad. Maybe mad. Sad and mad. See, I don't understand how our governments, past or present, can just simply ignore the healthcare needs of our people. Do they not understand that the basic needs of the people need to be addressed before anything else, before they even focus on themselves? It is a shame that the leader that we have now and his wives and other leaders as well will take millions to build mansions and little mansions and offices or whatever it is for their families, but not care about the health needs of the citizens that voted for them and helped them, provided for them, helped them, paid them, at least paid them, and hopefully it's they're using their paid money to build these mansions, paid them, so that they can have these luxuries, It is time, Mr. President, and this government, it is long overdue actually for this government to give back to the Gambian people in a more significant way. Okay? It's been 3 years and you are enjoying the benefits of your job, but you are not doing the job. That's unfair. That's where I have an issue with this government. That's where I have an issue with Adama Barrow. Nothing else. We all know that COVID-19 has been more challenging than it needed to be for the Gambia, and probably for many African countries as well, because the governments that we put in place never ever prioritize the things that the people need. Instead, they take pride in prioritizing things that have no lasting value to Gambians. When this government leaves in 2 years, will you be able to say that your lives have significantly changed for the better because of this government? Will you still vote for them? If your daughters and your wives and your sisters keep dying whilst delivering because of the lack of basic medical equipment or medicine or blood needed to save them. moo tax maa dee wax ne ñun Gambians yi ñooy sonal suñuy ay nawle. Yéen mi joxe excuse pour government yi Gambia ou pour nguur gi yéen ay sonal Gambia. Yéen mi nga xam ne yéen ay jàppale government bi, yéen mi nga xam ne yéen a leen di support, yéen ñi leen di defend. Kañ laaj leen seen Ministry of Health mi nga xam ne moo nekk si ron nguur gi, lana tax lopitaan yi amut ventilators, lana tax lopitaan yi amuñ deret, lana tax suñ health professionals yi amuñ resources yi ak tools yi bagage yi nga xam ne moom lañ soxla pour mun a def seen liggéey ba mu baax pour mun a toppatoo wér-gu-yaram waa Gambia. Laaj leen lana tax suñ jigéen yi di wasin di dee ci lopitaan yi. Mbiri yàlla moom am na, waaye nag lii xew si suñ lopitaan yi ni suñ lopitaan yi mel fi mu nekk nii ba suñ nit ñi di fa dee, loolu moom negligence la de. Don't be confused. Bu leen confused de. Think about everything that the Gambia government has spent money on in the past 3 years. I'm quite sure you can think about a few things or think of a few things that were just unnecessary wastage. When the money could have been used to help fund excuse me, the healthcare sector, right? Excuse me, guys. Dama ne woon duma waxati sax ci mbiri Gambia. Excuse me. Dama ne woon dama focus rek si suma personal project bi nga xam ne moom lay def su loolu demee ba sotti ma mun a am tamit am doole am impact def suma little part wi ci Gambia. Waaye dama ne dafa metti ngay seetaan sa dëkka di gis how the lives and the health of Gambians are being neglected. Mel ni du ay nit ngeen di jiite. Nga xam ne man dëkk bi nga xam ne sax fii laa nekk nii seen healthcare system bi, even though it's not the best in the world, citizens yi saa yu nekk ñu complain every day. We all complain. But the system is regulated, and healthcare professionals are very careful when they handle patients because they value the lives of the people that they treat. And of course, they really don't want to get sued. They want to avoid the lawsuit, right? Okay? The hospitals here are held liable for these things, for deaths and a whole lot of things based on negligence. We in the Gambia need to put a system in place, a regulatory system in place that will help protect the patients that go to these hospitals. There have been too many unacceptable unanswered deaths, and it's just no longer acceptable. It never was, actually. We need to start suing these hospitals to prevent negligence and incompetence in the way medical cases are being handled in the Gambia. Why is it that we keep putting in place governments, we keep choosing governments that lack the ability to give Gambians the financial and political commitment to reform and manage our healthcare sector? I'm sorry, Gambians. What are you voting for? You're just voting because it's fun to do so? You don't really care what you're voting for? You don't care about the issues? I don't get it. Oh, there's a fly. Sorry. This government and its Ministry of Health have a big role in Fatumata. I don't know why this little fly. There's something like flying over my face, but they have a big role in Fatumata Diba's death. And they have a role in a lot of other deaths, be it maternal deaths, maternal delivery deaths, or any other deaths due to medical conditions that could have been treated and prevented had our healthcare system been, had they prioritized our healthcare system, had the government done that. I watch some of y'all say violent politics be ning focus chi ligay suñu réew kon nag wax leen government yi Adama Barrow mu liggéey suñu réew de ah mu liggéey suñu lopitaan yi man daal dama foog ne wax lu dut yoon ci sa nguur ki nga xam ne moom yaa ko votal tegal ko foofu ci liggéey réew bi la bokka de. Who is supposed to make sure that pregnant women don't die in hospitals whilst having their babies or right after they've given birth to their babies due to negligence? Whose fault is that? Whose fault is it that patients with serious illnesses like cancer patients and other serious illnesses cannot get good treatment in the Gambia? They have to travel to Senegal or somewhere else. If the people, whose fault is it if the people in our hospitals are not doing their job? Well, whose fault is it? Is it my fault as a citizen? Is it your fault as a citizen? And so we go back to the fact that instead of wasting all the money that they received in the past 4 years on whatever it is that they wasted it on, I mean, I don't see anything. Lan ngeen gis loo xam ne dina tax yéen seen life dem kanam yéen Gambians si loo xam ne nguur gi def nañ ko in the past 4 years. They could have helped the people. One thing they could have chosen, healthcare, and said, I'm going to help these people. Before I leave, I'm going to help the Gambian people. The Ministry of Health and the people that run it were put in charge by a politician that you voted for. If they are failing, well, this government must be held accountable for that. Simple as that. This government, Dr. Samate, all of them must be held accountable for that. People, this is a political issue. Your lives are politics. Your life is politics. Because the politicians are the ones that have the ability to make decisions that affect your life as a Gambian. So stop saying we can't point at them and help us force them to take care of the health of the Gambian people. Even if you support them, even if you defend them, this is the time for us to unite. Fight for issues that matter. Digala, mange support Adama Barrow, why lopitan yangi bon, wako digabi. Wako digabi. So they yangi support Adama Barrow. Tenga gis ne lopitan yangi bon. I'm sure at some point some boka dem na chi lopitan be complain. I'm not, so do some boka tamboki ni yangi there for. Huh? Why the problem with Gambia is that negligence be then ko accept as Gambian citizens. Incompetence then ko accept. Many maternal deaths are preventable, and it is time for us to force our government, present and future, to address it. We need to force them to address it. Gambians, your health matters. The health of your wives and daughters matter. The health of your sisters matter. Okay? You as men, your health matters. So please, I am begging you, before you vote for Adama or Usainu or Halifa or Mai or Tuma or Mary, please ask them what they plan to do to improve the healthcare sector. These are the issues that should matter to you. They need to give us a solid plan. Stop this cult style voting. I don't know if that's even the word for it. Voting for people who do nothing for you. Put your leaders to work. Vote for healthcare. Vote for education. Vote for job security. Vote for the things that matter. Vote for issues. Vote on the issues. Don't join the bandwagon. Think for yourselves. Analyze the information you get from the politicians and see if it will help you. See if it will help Gambians as a whole. That's what your tax money pays them for. Bu la ñàkk fayda waaye yéen tamit ah yéen a votal ñi ñoom dañ ñu wala liggéeyal nañ ñu liggéeyal ah nañ ñu liggéeyal. Healthcare is important. Affaire yi yëpp tukki yeeg all sorts of nonsense yi ñu def in the past week lan la ñu defal seen lopitaan yaa ngi nii bon ba tey ah lopitaan yaa ngi bon xoolal lii happen si lopitaan yi every time nga dégg nit dee na fa su dul affaire yi jigéen bu wasin ku dee muy keneen koo xam ne su doon beneen dëkk la nekk du dee ah because ñun suñ healthcare system bi dafa bon waaye suñ government bi is not a priority to them leen ay priority bills and mansions yee seen kër yee seen fu nekk ah yéen tamit amal leen ñu yërmande yéen tamit ah amal leen citizens yi yërmande yéen tamit yéen nguuri Gambia yéen tam amal leen ñu yërmande jërëjëf. Thank you guys for watching. I appreciate it.